You have probably heard of pelvic floor therapy, and we're here to tell you about the role of occupational therapy in pelvic health rehab. In general, OT practitioners specializing in pelvic floor therapy encompass a lot of areas for their clients, such as teaching clients to correctly perform pelvic floor muscle exercises, including contraction and release, to develop good coordination and develop a strong, flexible pelvic floor that supports the pelvic organs. Provide education around diet, which includes increasing fiber and fluid intake to decrease constipation and strain during voiding, and education about factors and lifestyle changes that can help reduce the incidence and prevent worsening of pelvic organ prolapse. We also assess and address poor body mechanics and compensations that may exacerbate a person's pelvic organ prolapse symptoms by means of ergonomic and core strengthening training. We teach self-regulation techniques, including progressive muscle relaxation and mindfulness, to decrease anxiety while improving body awareness. We also use environmental modification strategies to reduce lifting, straining, or pulling, which can aggravate pelvic organ prolapse symptoms. And we also train clients to decrease their intra-abdominal pressure by breathing and exhaling with movement or effort, such as when we're picking up a baby, loading the laundry, loading and unloading the dishwasher, and all the things that you have to do every single day. As occupational therapists, we look at your performance patterns that impact your pelvic health. This includes your roles, habits, routines, and rituals, and we ask, how do you spend your time during the day, and how can we make it more meaningful for you? We take a whole person approach to consider not only your biomechanics, but also the brain, the body, and the being. We call our unique perspective the 3BX approach: the brain, the body, and the being, because it is your lived experience that matters the most. Occupational therapy takes a look at what an individual does throughout their day that may be helping or hindering overall health outcomes. For pelvic floor health, this can include noticing if and when a person may be holding their breath to complete their daily tasks, which can create pressure management strain on the pelvic floor, or assessing a person's body positioning during daily activities and whether or not these impact pelvic floor health. This can include showering, toileting, care of others, cooking, cleaning, to sitting, standing for prolonged periods of time in the office, while driving, or even pushing a grocery cart. We may not think it matters, but even a slight change in the way that we do things in our daily routines can help address pelvic floor symptoms. It might be something as simple as getting closer to the counter so that you don't have to consistently reach so far outside of the base of support of your body to grab an item from a cabinet, to maybe not back bending and flaring out the ribs when showering so water doesn't splash on your face. To take this one step further, occupational therapists also consider and help clients understand their sensory systems and how avoiding or seeking sensory input impacts the pelvic floor. Occupational therapists are true hands-on body, brain, being practitioners, and we're constantly assessing the most optimal ways to help a client move, breathe, and be the best they can in their present activities and within their present situations. Now that you've heard a little bit about what OT does for pelvic floor dysfunction, please refer to us. We strive to provide client-centered care that is meaningful to patients, and look forward to being a part of the continuum of care team and providing one-on-one holistic pelvic health rehab for your